A stroke does not always begin with collapse. It does not always announce itself with a dramatic moment that leaves no room for doubt. In some people, the body starts sending signals hours earlier, sometimes even the day before, and those signals are often subtle enough to be brushed aside. That is what makes this so dangerous. The warning may be there, but it may not look the way most people expect. I'm Dr. Marcus Evans, medical doctor and physician, and on this channel I help break down what may be happening inside the body in a way that is clear, practical, and grounded in real health logic. If that kind of calm, straightforward information is helpful to you, make sure you subscribe and stay connected. What makes stroke so frightening is not only how serious it is, but how often people miss the short window when action could make the biggest difference. Many viewers imagine a stroke as something that strikes out of nowhere. One minute everything is normal, and the next minute a person cannot move, cannot speak, or collapses to the floor. And yes, that can happen. But that is not the full picture. Sometimes the brain gives a warning first. Sometimes the body flickers before the lights go out. That early stage can be easy to dismiss. A person may suddenly feel strange for a few minutes and then feel almost normal again. Their speech may sound slightly off, then return. Their face may feel odd. One arm may feel weak or unusually heavy. Their vision may blur for a moment and then clear. They may feel briefly confused, dizzy, or off balance, and then tell themselves they are tired, dehydrated, stressed, or simply having a bad day. But when symptoms appear suddenly and do not fit the situation, especially when they affect one side of the body or interfere with speech, that is not something to casually explain away. One of the most important ideas to understand here is that a stroke does not always begin as a full stroke. In some cases, the body experiences what many people call a mini stroke. The medical term is a transient ischemic attack, often shortened to TIA. This happens when blood flow to part of the brain is blocked for a short time and then restored before permanent damage becomes obvious. That may sound less serious because the symptoms can disappear, but in reality, it is often a medical warning shot. It is the body's way of saying that something unstable is happening in the circulation that feeds the brain. And this is where many people make the mistake that costs them precious time. They assume that if the symptom went away, the problem went away. But that is not always true. In fact, symptoms that come and go can be especially dangerous because they create false reassurance. The person thinks, I'm fine now. The family thinks, maybe it was nothing. And the very event that should have triggered urgency gets minimized because it was brief. The brain depends on constant blood flow. It has no real backup supply it can rely on for long. Even a short interruption can affect speech, vision, movement, memory, or awareness, depending on which area is involved. If that interruption happens briefly and then resolves, the outward signs may fade, but the underlying danger may still be very much alive. The clot may still be present. The blood vessel may still be unstable. The rhythm of the heart may still be sending clots upward. The pressure inside the arteries may still be damaging delicate tissue. In other words, the event may have passed, but the threat may not have. This is why the day before window matters so much. The body may not whisper twice. For some people, there is a short stretch of time when the signs are quieter, shorter, easier to excuse. Then later, the full event arrives with much greater force. And by then, the chance to act early may already be gone. What makes this harder is that the early signs do not always feel dramatic. They may not be painful. They may not be constant. They may not even last long enough for the person to think the word stroke. That is exactly why the danger is so often missed. People are waiting for something big, when what actually appears first may be small, strange, and brief. So the real question is not just whether a stroke can warn you. In many cases it can. The real question is whether you recognize the warning for what it is. Because when the signal is subtle, the mind tends to reach for harmless explanations. Maybe it is low blood sugar. Maybe it is stress. Maybe it is fatigue. Maybe it is age. But sudden neurological symptoms should never be filed away that quickly, especially when they are new, unusual, or hard to explain. And that brings us to the part that matters most. If the body can send signals before a major stroke, what do those signals actually look like in real life? Because some of the most dangerous ones are not dramatic at all. They are quiet, brief, and easy to miss until it is too late. The problem with early stroke symptoms is that they often do not look dramatic enough to trigger immediate fear. They can be brief, they can be mild, they can come and go. And because of that, people often talk themselves out of taking them seriously. But when these changes happen suddenly, especially if they affect movement, speech, balance, or vision, they should never be treated like a minor inconvenience. One of the most common warning signs is sudden weakness or numbness on one side of the body. That may mean an arm feels heavy for no clear reason. It may mean one leg feels strange while walking, almost as if it does not fully belong to you. Some people describe it as clumsiness. Others say their hand suddenly feels unreliable, and they begin dropping objects or struggling with simple tasks that normally take no effort at all. What matters here is not whether the weakness is extreme. What matters is that it appears suddenly and affects one side more than the other. Another important sign is a brief change in the face. A person may look slightly uneven when they smile. One side of the mouth may not move normally. The face may feel numb, tight, or unusual. Sometimes this lasts only a few minutes, which is one reason it gets brushed aside. But the face is controlled by the brain, and when facial movement suddenly changes, that should always raise concern. Speech changes are especially important. A person may suddenly slur words, struggle to pronounce simple sentences, or sound as if their mouth is not fully cooperating. In other cases, the speech is clear enough physically, but the brain has trouble finding the right words. They may pause strangely, use the wrong word, or seem confused in a way that is out of character. Family members often notice this before the person does. They may hear a sentence that sounds just a little off, a little slow, a little scrambled. That may not seem dramatic in the moment, but sudden speech trouble is one of the clearest neurological warning signs the body can give. Vision changes are another major clue. Some people experience blurred vision in one eye. Others notice dimming, double vision, or a sudden partial loss of sight that feels like a curtain moving across part of what they can see. Sometimes it clears quickly, which leads the person to think it was eye strain, fatigue, or poor lighting. But when blood flow to the brain or the eye is interrupted, vision can be affected suddenly, and that should never be ignored just because it improves. Dizziness and balance problems also deserve serious attention, especially when they appear out of nowhere. A person may feel unsteady, veer slightly when walking, or suddenly feel disconnected from their normal sense of coordination. This is particularly important when dizziness is paired with other symptoms like blurred vision, weakness, numbness, or confusion. Many people dismiss this as dehydration, standing up too fast, or inner ear trouble. And sometimes it is one of those things. But sudden balance changes can also point to a problem affecting the brain, especially if the person feels noticeably different from normal. Confusion itself can be one of the earliest signs. A person may seem mentally foggy, have trouble following a simple conversation, forget what they were doing, or respond more slowly than usual. Loved ones may notice something is wrong before the person feels alarmed. They may say, "You're not making sense," or "Why are you acting so strange?" That kind of sudden shift matters. When the brain is not getting the blood flow it needs, even briefly, thinking can become disrupted very quickly. Then there is the sudden severe headache. Not every stroke begins with headache. But when there is a sudden, unusual, intense headache, that feels different from anything the person normally gets, it should not be shrugged off. This matters even more if it appears with nausea, vision changes, confusion, weakness, or trouble speaking. The key is not just the pain itself, but the fact that it is sudden and unusual. What makes all of this so deceptive is that these signs may last only a short time. The signs may last 5 minutes, or they could last 10 minutes, even 20 minutes. Then they fade. That short duration tricks people into feeling safe. They assume that something serious would last longer, but that assumption is exactly what creates danger. A symptom does not need to last an hour to matter. A brief neurological event can still be a warning that a much larger stroke may be close behind. This is why suddenness is such an important word. Stroke warning signs tend to arrive abruptly. They do not usually build slowly over weeks like general fatigue or aging-related stiffness. They show up in a way that feels different, strange, and hard to ignore in the moment, even if the person later tries to rationalize it. So if a symptom is sudden, one-sided, neurologic, unusual, or hard to explain, it deserves immediate respect. Not tomorrow, not after a nap, not after waiting to see whether it returns. That may feel like an overreaction, but in stroke care, speed is not panic. Speed is protection, and every second counts. And yet symptoms alone are not the whole reason people miss these events. The deeper problem is that many people are expecting the wrong kind of warning, and that false expectation is exactly what causes them to overlook the signs that matter most. A large part of the danger is not just the symptom itself. It is the story people tell themselves about the symptom. That story is often what delays action. Instead of treating the moment like a medical emergency, they begin searching for a harmless explanation that feels easier, less frightening, and more convenient. And in the case of stroke, that instinct can be incredibly dangerous. One common mistake is expecting stroke symptoms to be dramatic from the very beginning. People often imagine a person collapsing to the floor, unable to move or speak, with no uncertainty about what is happening. But the early warning phase does not always look like that. It can be subtle. A sentence may come out wrong. A hand may suddenly feel weak. Vision may blur for a few minutes. a person may feel briefly disoriented, then seem almost normal again. Because the symptom is not extreme, they assume it cannot be serious. That assumption is exactly what puts them at risk. Another mistake is believing that serious symptoms have to last a long time. If the weakness passed in 10 minutes, they think it could not have been a stroke warning. If the speech returned to normal, they assume the danger is over. But short-lived symptoms can be some of the most deceptive of all. A transient ischemic attack can act like a warning flare. It rises, alarms the system for a moment, then fades. The disappearance of the symptom may feel reassuring, but it does not necessarily mean the circulation problem has resolved safely. Sometimes it means the body was given one brief chance to speak before the larger event arrives. People also misread these symptoms because they blame them on far more familiar problems. They blame stress, they blame poor sleep, they blame dehydration, low blood sugar, fatigue, anxiety, medications, or simply getting older. And to be fair, those things can cause people to feel off. But stroke-related changes tend to have a different pattern. They are sudden, they are unusual. They do not fit the person's normal day. They often involve one side of the body, speech, balance, or vision, in a way that feels neurologic rather than general. Still, because the human mind prefers a less threatening explanation, many people minimize the moment instead of respecting it. Age adds another layer to this problem. Older adults sometimes dismiss new symptoms because they are used to dealing with discomfort, stiffness, fatigue, and occasional off days. They may not want to worry family members. They may not want to go to the hospital unless things become severe. Some are afraid of causing a false alarm. Others simply do not want to believe that something serious may be happening. So they wait. They sit down. They lie down. They tell themselves they will see how they feel in an hour. But in stroke care, that hour can matter more than people realize. Family members can miss it too. They may notice that a loved one is speaking strangely, walking differently, or acting confused. But if the person seems mostly okay a few minutes later, the concern fades. In some cases, the temporary nature of the symptom is exactly what should raise concern, not reduce it. A useful way to think about this is to picture the brain like a city powered by a delicate electrical grid. If one neighborhood suddenly loses power for a few minutes, then the lights flicker back on. Nobody should assume the system is healthy. The flicker is not proof that everything is fine. It may be a warning that something deeper is unstable in the main line. The temporary return of function can create false comfort, but the underlying problem may still be building towards something much worse. That is often how stroke warnings behave. The lights dim, they come back. And people mistake that for safety. Another reason warning signs get ignored is that people expect pain. Weakness is not necessarily painful. Speech trouble is not painful. Numbness, facial drooping, or sudden confusion may feel strange, but not painful. When there is no major pain, the brain tends to downgrade the urgency. People think, if it were serious, it would hurt more. That is not how stroke works. The brain can be in danger even when the symptom feels oddly quiet. This is also why loved ones should pay attention to behavior changes that appear abruptly. A person who suddenly cannot find words, looks uneven in the face, seems oddly confused, or starts leaning to one side, may be showing you something important even if they insist they are fine. In these moments, observation matters. In critical moments, calm and decisive action matters, and delay can be costly. The hardest part is that many people only realize the importance of the first warning after the second event hits harder. By then, the body is no longer whispering. It is forcing the issue. That is why recognizing these early signs is only half the battle. The other half is knowing exactly what to do the moment they appear, because the right response in those first minutes can change everything. Recognizing a stroke warning sign is critical, but recognition alone is not enough. The next decision is what determines whether that warning becomes an opportunity to intervene or a tragedy that might have been prevented. When symptoms appear suddenly and suggest a possible stroke, the safest response is not to wait, not to lie down, not to see whether it passes, and not to schedule an appointment for later. The safest response is to treat it like an emergency right away. One of the biggest mistakes people make is trying to drive themselves. That can be extremely dangerous. Stroke symptoms can worsen suddenly, and a person who seems mostly functional 1 minute may lose coordination, vision, speech, or awareness the next. Driving in that condition puts the person and everyone else on the road at risk. It also delays proper care. Emergency teams can begin evaluating the situation immediately, and they can bring the patient to the right kind of hospital without wasting valuable time. Another common mistake is trying to sleep it off. People often say they will lie down, rest, and check again later. But sleep does not fix blocked blood flow to the brain. In some cases, it simply wastes the window when treatment could have helped the most. The same is true for calling the doctor's office and waiting for advice hours later. A possible stroke is not a routine office issue. It is an emergency issue. A simple tool that can help people remember the most common stroke signs is the word FAST. The F stands for face drooping. Ask the person to smile. Does one side of the face look uneven? The A stands for arm weakness. Ask them to raise both arms. Does one arm drift downward or fail to lift normally? The S stands for speech difficulty. Ask them to repeat a simple sentence. Is the speech slurred, confused, or unusual? The T stands for time to call emergency help. If any of those signs are present, even if they seem to improve, act immediately. FAST is useful, but it does not cover every stroke warning sign. Some strokes begin with sudden vision loss, double vision, dizziness, poor coordination, confusion, or a severe headache that feels very different from the person's normal headaches. These signs also matter, especially when they appear abruptly and do not fit the situation. The key idea is not to memorize every possible symptom perfectly. The key idea is to respect sudden neurologic change. If symptoms appear, try to note the exact time they began, or the last time the person was seen acting normally. That detail can be extremely important for emergency teams because some stroke treatments depend heavily on timing. In stroke care, minutes matter because brain tissue depends on blood flow every second. The earlier the problem is recognized, the more options there may be to reduce damage. It is also important to report symptoms honestly, even if they have already disappeared by the time help arrives. People are often tempted to downplay the episode because they feel better. They say things like, "It was probably nothing," or "I'm okay now." But temporary symptoms can still point to a transient ischemic attack or an unstable circulation problem that needs urgent evaluation. Emergency responders and hospital staff need the full story, not just the current appearance. Protection also begins long before the warning signs show up. Stroke risk is closely tied to certain conditions and habits that quietly damage blood vessels over time. High blood pressure is one of the most important. It places constant strain on the arteries, including the delicate vessels that supply the brain. Diabetes, smoking, high cholesterol, obesity, and lack of physical activity can increase your risk substantially. Irregular heart rhythms, such as atrial fibrillation, are also major factors. A prior mini-stroke is another major warning sign that should never be ignored. That means part of protecting yourself is knowing your own risk profile. Do you know your blood pressure? Has your doctor ever mentioned plaque, cholesterol, diabetes, or heart rhythm issues? Have you ever had a brief episode of speech trouble, numbness, weakness, or vision loss that was never fully checked? These questions matter because prevention is built on awareness and action. A stroke does not always announce itself with drama. Sometimes it sends a brief signal first. A strange sentence, a weak arm, a drooping smile. It is one of the most common signs. A sudden loss of balance, a few minutes of confusion that seem to pass. Those moments may look small, but they are not small if they are coming from the brain. They may be the only warning the body gives before something much more devastating follows. So take sudden neurologic symptoms seriously. Trust the abruptness. Respect the unusual, and never assume that disappearing symptoms mean disappearing danger. The goal is not to live in fear. The goal is to act early enough that fear never gets the final word. If this helped you understand stroke warning signs more clearly, subscribe and keep following along with us. And please share this with someone in your life who is over 60, has high blood pressure, or tends to ignore symptoms and wait too long. Sometimes one piece of information, remembered at the right moment, can make all the difference.